So today I've got Dr. David Smith, who's a interventional pain specialist in Canada right now. Very well qualified. He's done his residency at Columbia. I think I've heard of that school before. He did his residency at the Cleveland Clinic, where he also did a fellowship. And over the past 2.5 years, we've known each other. He's been back and forth to a lot of conferences, and we've had a lot of interactions between each other, asking questions. And he's been really interested in doing more and more regenerative medicine in Canada until just about a couple weeks ago, when the Canadian government decided that all cell therapy is going to be put on hold. And so we're going to have David kind of talk about this ruling, because this has definitely affected his life. And he's very skilled, very conscientious about what he's doing. And I just love to get his ideas about how this ruling is going to be affecting not only your practice, but the healthcare of a lot of Canadians.
Yeah. Thanks for the introduction, Ed. It's great to talk to you.
So why don't you go ahead and tell us how this ruling came about? You've read through the ruling, and why don't you give us a little synopsis of what you found?
So we've been in my clinic in Kingston, Ontario. We had been doing an increasing amount of regenerative medicine over the last 2.5 years, and using mainly a combination of bone marrow concentrate and platelet-rich plasma, depending on the patient and the indications. This past October, in 2018, we received a letter from Health Canada that it basically said, you are one of 22 clinics in Canada that we are aware of that is currently advertising and offering stem cell treatments in Canada, and the letter was asking for some details and for us to answer some questions about exactly what we were doing. My initial reaction was the tone of the letter sounded very reasonable to me. The letter said that that Health Canada is trying to put together a regulatory framework as far as the delivery of regenerative medicine and cellular therapies in Canada, and they asked a series of questions that seemed to me to kind of mirror some of the FDA regulations in the United States. So, for example, they asked us, what is the source of your stem cells? Where are you obtaining your stem cells? Are you getting them from bone marrow? Are you getting them from adipose tissue? Are you processing the bone marrow after you harvest it from the patient in any way? Are you treating it with a chemical? Are you culture expanding it? Are you modifying it in some way? And they also asked, they wanted to know, what indications are we treating? How are we delivering it? Are we giving it? Are we injecting it into soft tissue? Are we administering it as an intravenous infusion? and what indications are we treating, and what promises or or what expectations are we giving to our patients as far as efficacy and chances for response.
So,
And
I mean, these are all pretty good basic questions that I think I would welcome any government agency to ask me the same questions. I think that's what they should be doing.
yeah,
And so they were asking these questions, but how about like where did they come from of why they made this ruling? Because as we were talking about earlier, there's a lot of safety studies that were done. One of them actually done right in Canada about how safe these procedures are. So why was this brought up all of a sudden?
the the point I was making was that after that initial interaction in October, and we sent back a response with carefully thought out answers, and basically we were trying to say, we think that we're practicing in an ethical manner. We are trying to trying to practice in a way that is in line with the FDA guidelines in the United States, because that was really the only thing that we had to go on. And then we had no interaction since then. We didn't get any response from Health Canada. We didn't get a request for additional information. Nobody asked us for us to submit a list of scientific references, or for us to participate in a conference call, or to pay a visit to Ottawa to sit down at a meeting and talk about what we were doing and why. And many months passed, and we continued to practice. And then the next thing that happened was I actually got an email from a colleague in Toronto, who said to me, Health Canada has just issued new regulations, and it looks like regenerative medicine is basically going to stop functioning at this point. And that was the first I had heard of it. So there really was no warning. We answered a letter in October, and 4 weeks ago regulations were published, and that was the next thing that we knew.
And you've read through their statement, and I've read through their statement. And I mean, do you have any key points about what they went ahead and proposed in their official statement?
Well, the main they made a few points. I mean, I think their first point was that that Health Canada was stating that they considered all cellular therapies, except for the use of hematopoietic stem cells in the treatment of
Lymphoproliferative disorders.
Yeah, exactly. But bone marrow cancers. That other than that, all cellular therapies are considered a drug. They're going to be regulated as a drug. And then one of the very important passages was where they mentioned that they made sure to point out that although there was an exception in the United States for bedside treatments with bone marrow concentrate that would be harvested, minimally manipulated, and then immediately given back to the patient, that although there was an exception for those circumstances in the United States, Health Canada made sure to stress that exception did not exist in Canada. And so, at that point, we knew that that what we were doing was no longer going to be allowed as it had been previously. And then the second point they made was, they said, because we consider this a drug and we consider it experimental and we consider that safety and efficacy have not been established, that in order to continue offering these treatments to patients, that we would be required to submit a clinical trial application and only treat patients in the setting of a clinical trial.
Yep.
So that they were making the point that they don't consider this a medical procedure that would be regulated by the medical board or the College of Physicians and Surgeons of Ontario. They consider this a drug, and as a drug, it has to go through a drug approval process. Yep. So they were making the conclusion that a patient's own bone marrow, harvested from them, spun in a centrifuge, and then administered back, is now considered a drug in Canada.
Yeah. So since it's been considered a drug, and you voluntarily stopped doing this, which you're just trying to be a good citizen of Canada.
Right.
But what do you think this would mean, though, to the citizens of Canada at this point? Do you think that this is good for them? Do you think that this is bad, or you just don't have an opinion?
Well, I think that we, as a chronic pain physician, we are dealing with patients that that are dealing with serious, ongoing, moderately severe or severe chronic pain that is, affecting their lives in significant ways. Both threatening their ability to work, threatening their ability to function personally and within their families, threatening their emotional well-being, and oftentimes in chronic pain, we try many of the traditional methods of treatment, and sometimes those don't work, and so we're dealing with desperate patients that we're trying to help, and this was an area of therapy that we were offering, and that we were and me personally, I was seeing very surprising results. Results that really surprised me as a chronic pain physician with a solid 8-9 years of experience.
So, David, let me ask you this question. In Canada and all the patients that you treated, did you ever have a complication, anything that you would normally report to an M&M conference, that you saw any type of adverse event from any of the procedures that you've done?
I don't think any of us had seen any adverse event that struck us as unusual. Yeah. One of the safety reviews that was done by Dr. Centeno's group out of Colorado, where they looked at 2,300 patients over 2 years' time, and the only complication of any significance that they found was pain or discomfort at a treatment site. And I think that was in about maybe 3.9% of patients. And other than that, they didn't really note any specific complications. And I think our experience went along with what was reflected in their paper.
Yeah, and same thing with ours. In our database that we have right now, about 6% of the patients have experienced bruising, at the site of the harvest or the injection. So, very similar. And we also have Philippe Hernigo's study of over 1,000 patients. And then We even have the Safe Cell study again that we just referred to that was done in Canada, or it was reviewed in Canada, and looked at numerous studies and really didn't find any significant adverse events. So I'm just trying to understand where the government came from to issue this ruling here, because usually they do if there's something that they're concerned about, like there's some safety event or some type of adverse event that has occurred that's been brought to their attention. And
Yeah.
you don't know of any.
Well, I don't know of any, with, uh, I don't know of any specific adverse events in the setting of doctors that are using bone marrow derived stem cells from bone marrow aspirate and using them for orthopedic indications for the treatment of soft tissues like ligament and tendon, or for the treatment of osteoarthritic joints. So in that setting, there aren't any specific adverse events that I've seen, and I think that some of the concerns that were reflected in Health Canada's publication. For example, they mentioned their concern with viral or bacterial transmission. They mentioned a concern with tumor formation.
Yes.
And we know that um, in Centeno's study of 2,300 patients, we know that, in my opinion, is that with a follow-up period of 2 years, that's an adequate time period to pick up on any significant incidence of bacterial or viral transmission. That would be a sufficient time period to pick up on any significant incidence of infection. Yes. And then in Dr. Hernigu's study of 1,800 patients followed over an average of 12 years with a range of between 5 and 22 years, where they analyzed over 7,000 MRI scans and over 50,000 radiographs, and showed that there was no incidence of tumor formation at the treatment site, and that there was also no evidence of any increased risk of tumor formation elsewhere in the body when compared to the average risk of tumor formation in the general population. So I think there had already been some well-conducted studies that addressed some of the concerns that Health Canada voiced in their publication, but those safety studies were not mentioned or discussed, as far as I know.
Yeah, it wasn't in the paper. I looked for them. I tried to find something that they would reference. They have a few references at the bottom of their statement, but they don't really deal with the safety or efficacy of this. And here's some of my thoughts on this, because if they're saying that basically all cell therapy, well, allografts that are used, that's cell therapy. So receiving ACLs, people that have bone grafts that are being done for spinal fusions, people that have skin grafts, those are autografts. Are they going to have to stop that because that is a cell therapy? And that's how the FDA actually looked at bone and bone marrow, that it was very similar to bone grafting that we do and has a very good safety record. Also, the studies of microfracture of the distal femur and proximal tibia and knees, and showing no adverse events with it, and that's all bone marrow. So I don't know. I'm just really trying to understand where did the Canadian government come from in making this ruling. And I applaud them for trying to protect the citizens of Canada, but I just am lost at where they got this idea from.
I'm not clear on that either, and I think some of this comes from adverse events in patients that were getting treated in less orthodox ways. So for example, in the United States, there were cases of doctors that were harvesting adipose-derived stem cells and injecting them into the eyeball,
Yeah.
and then a series of patients were blinded, and then that, I think, cast a shadow across the rest of the physicians that were, like you and I and others, that were practicing in a more evidence-based, ethical way.
Yeah.
And when those events happen, they understandably lead to an emotional reaction, and sort of a regulatory backlash.
Yeah. And the Kristen Camella, who was involved in that, just had a summary ruling just the other week regarding that. And it should be pointed out that those events, which were either 2 or 4, it's kind of unclear exactly how many it was, that's really the only events that we have recorded. And in fact, when the FDA had a hearing, I think it was in 2016 in October, those were the only events that came up, other than maybe this one gentleman that lived in California but went all over the world for numerous treatments to his spine and ended up with some unknown type of tumor in his spine that we don't know what type of treatment he had.
Yeah.
So there was no conclusions on that. So that's really the only adverse event that we have recorded from this. In my experience, there have been some, like we talked about bruising, but some of the adverse events that I've had on the patients that we did this during surgery, most of those were due to the drugs that were given during the surgery, uh, and not due to the cells themselves. We just had an event with somebody we think that had a factor V deficiency that was given by thrombin used during the procedure and not the cells themselves.
Yeah.
So, if anything, it's the other things that we use in this rather than the cells that have caused the adverse events. It just kind of makes, just logical sense. These are their own cells. We're not doing anything to them. We're just separating them out and giving them back. And I think that's why the FDA said that's fine. So let me kind of ask you this question. So what do you think people in Canada are going to do if they do want cell therapy? Where are they going to go for this? Do you think that they're going to head out to the Cayman Islands or to somewhere in Indonesia? What's your feeling on this?
Well, I can give you direct knowledge of that because I had, around the time that around the time Health Canada published this, published these findings, I had, probably 10 to 12 cases already scheduled for the upcoming several weeks, and I had to cancel all of those cases. I had to explain to the patients that that I was no longer able to currently offer the treatment that I had recommended, and I know firsthand from those patients that several of them said that they were going to be going to the United States to have treatment done for sure, and I know several of my patients were already mentioning, treatment centers in Vermont or treatment centers in Texas or Colorado, and I also have friends and colleagues in the United States that even before the Health Canada regulations came out, they were already treating Canadian patients. So and we have some patients that are extremely educated. They've done a lot of research. So, for example, one patient said to a colleague of mine, well, I understand that Health Canada is saying that you can't use bone marrow concentrate, but I'm wondering whether you can treat me with bone marrow aspirate. And that's a very intelligent question.
Yeah.
So some of these patients are highly educated, and they're already coming up with their, how they are going to respond, and what alternative places they are going to go to get the care that they decided, makes best sense for them.
Do you think that some of this action by the Canadian government was initiated by some of these fly-by-night clinics that have set up that are claiming that they're delivering a cell therapy and that it has no cells in it whatsoever? And those are if you look at the Livion incidents that happened in December, where we had 13 people that were infected with E. coli. And those weren't even cell therapies.
Yeah.
That was advertised as cell therapy, but it had no cells in it. Do you think that could have been the nidus that started this?
Well, I think like I said, I think it's a combination of things. I think that the regulatory authorities, were, concerned with this, concerned about the possibility that, that inappropriate therapies were going to multiply, and that they were going to have trouble, taking regulatory action against, hundreds of places that were starting to sprout up, and I think both you and I, we can understand that we can understand that fear. We can understand the fact that that they're worried about the safety of Canadian patients, but at the same time, I think there could have been an alternative where they made clear what types of treatments made sense and had a good safety record and good evidence for efficacy, and I think I wish that they had done a better job of outreach with some of the doctors that were doing this work, and that I think we're pretty well educated with the body of research behind what we're doing.
Yeah, and David, you went to school at Columbia. You did your residency at the Cleveland Clinic, two very well-respected institutions. You read, you keep up on everything. Did they even come over and inspect on what you're doing? It was just a questionnaire, right? They never came over. They never looked at what you did. They just made a ruling based on, I don't know what. I think, I wonder if it was just that they just decided to just shut down everything and then slowly open it back up, I guess.
That's what we're hoping. But time will tell. We're still trying to get details about what's expected, but if all of the private clinics that are interested in doing this type of work are required to carry on clinical trials, you really can't ask a patient to pay for a treatment that's part of a clinical trial. That's just not that's not practical. So if we're unable to to charge a fee for a treatment that requires equipment that costs $1,500 per case, and and doctors that are undergoing expensive training, and spending hundreds and hundreds of hours training themselves in ultrasound diagnosis and ultrasound guidance and fluoroscopic procedures, without the help of outside funding, we may not be able to provide these services at all. So we're still waiting to find out, what kinds of clinical trials are we required to perform, and we're not sure, whether or not we're going to be able to afford to run these trials.
Well, their statement referenced randomized controlled studies. So those are prospective. That does take a lot of money and a lot of effort, which I'm not against at all. But you're kind of stuck in a catch-22 here, because to get those, you have to be able to. The companies have to be able to sell, and if they can't sell, then they can't fund these. And I think a lot of people also assume that these companies have millions and millions of dollars. There's small companies that put this together. But there are a lot of randomized controlled studies that are coming out. I just came back from Toby, and there's a lot that are there that they just haven't been published yet. They're in their final phases, but that should be coming. So let me just one little thing, because we're running out of time here. But let me just talk to you about a statement that was made in the CBC report that came out too. And they talked about, and this is something that Arnie Kaplan himself, the person who named the mesenchymal stem cell, he's saying mea culpa, I should have never called it the stem cell, because he thinks it's more of a signaling cell. So now they're saying that this is really a mesenchymal stromal cell, which I'm fine with that, because I think that there's been a few studies that have shown that it's not really the concentration of the MSCs that give you the clinical result. It's the combination of the plasma proteins and the other growth factors. So what are your thoughts about just getting rid of this MSC, the mesenchymal stem cell? Just not call it stem cell. You could call it stroma cell, because I think that they feel that that's misleading the public. And I'm all for that. I think that if we just called it cell therapy, I think that would be fine, because I think it is misleading sometimes.
And I think I have no problem with that. And I think to a certain degree, the terminology is misleading some of the laboratory PhD critics of what we're doing. So they're focusing on the dangers of tumor formation, when they don't even understand that that we're dealing with cells that that don't really have tumor growth
capabilities. Yeah.
They're mature stem cells. They're not embryonic stem cells. But I agree. I mean, I think stem cell is a loaded word, and it's stimulating probably more controversy than's really necessary. And I agree with you. I think the efficacy of these treatments are I think I think modulation of the immune system's involvement in some of the pathology is really the thing that's more important than this idea that the stem cells are becoming new tissue.
No, you're absolutely right. And Arnie Kaplan himself has taken that diagram down of showing the stem cells forming different lines, and he just wants to get rid of that. And he wants to show the immunomodulatory effects of the cell. And that's probably the most important thing it does.
And I explain that in detail to my patients. When I'm explaining why I think these treatments are working for osteoarthritis, I'm explaining the modulation of the immune system, participation in the ongoing destruction. And, that's the emphasis of my discussion with the patients, not promising that they're going to get brand new tissue. I'm explaining that, that osteoarthritis is more of an immune mediated disorder than we had originally thought. And that's what we're treating.
Absolutely. I agree with you on
Yeah.
that. And being an orthopedic surgeon and going back in on some of these patients after they've had stem cell. There are some that we do see some cartilage formation on, but a majority they do not. And we make it real clear that we're not trying to grow anything. Their own native stem cells that are in their joint at that time, they can do it, but they can't do it when they're being insulted right now by a chemical insult, especially like interleukin 1 beta. So I think that we've covered a lot today. We covered what the Canadian government has ruled on, how that's affected your practice, how that's affecting Canadians. We're a little bit perplexed at why that happened. What was their logic in doing it? But you know what? Maybe this will make us better physicians because it'll allow us to go ahead and really focus in on proving that this is a safe and efficacious treatment.
Yeah.
So,
Yeah.
do you have any final comments?
The only other thing that I was going to add was, that when, when friends or family, ask me about, what I think of the regenerative medicine work I'm doing, and what I'm seeing, as far as, how my chronic pain patients are doing. Usually the comment that I make to them is that, um, that it wasn't until I started doing regenerative medicine treatments that I began seeing chronic pain patients that did not come back to see me. In all of the, in all of my experience before this, whatever chronic pain treatments that we came up with, they always had to be repeated. The patient comes every 3 months. The patient comes every 6 weeks. The patient comes every 4 months. They have to have their nerves burned over and over and over again. They don't really show permanent improvement. And then I started seeing some patients where, I had a patient who had, fairly severe plantar fasciosis. She had to walk on her knees at night to get to the bathroom. She had been, trying all different kinds of treatments and therapies for, say, the last 6 years. We did a bone marrow concentrate treatment, and she never came back. She got better.
Wow.
Wow. And those were the first cases that I had seen in my chronic pain career where, I saw people in follow up at, say 3 months and 6 months and 12 months, and they were always saying they were doing well, and I don't need to see you, doctor. And that's why that's the excitement and the promise of this area, and that's why, it's a little bit, it's a little bit disappointing that, kind of a barrier has been placed in front of me, as far as some of the work that I was doing, and some of the surprising results and improvements that I was seeing.
Yeah, there's at the most recent Toby, they had one study where they took mice and they made them opiate tolerant. This paper's been published. There's 2 of them, and they were able to eradicate, completely eradicate the opioid tolerance in these animals. And then they had a case report of a gentleman that was a vet and had chronic pain all the time, was totally addicted to opioids, and was basically cured. And then, unfortunately, one of the founders of Toby passed away from an overdose, and his father came up and gave a very stirring tribute to him immediately afterwards. So if he would have only used that, he would have still had a son. So it was, just to show us that this can be used for chronic pain safely. It's your own cells. Yep. And we'll just have to hope and pray that the Canadian government allows this to come back in for Canadian citizens.
Yeah.
Because I know we're in the U.S. we're not immune to the opioid crisis. It's just not us. It's everybody all over. So David Smith again. He's in a town called Kingston, Ontario, which is about 2.5 hours east of Toronto and about 2.5 hours north of Syracuse. So he's not too far away if you want to go ahead and visit him. He's an excellent physician. He's a great colleague. He keeps me honest. I hope I keep him honest. And David, we do have like one little extra part of our show here today where we do a little exercises. So I've been sitting here for about a half hour. I'm going to be doing a little bit of exercises here, stretching, and then scratch the back of my head here, and coming back and down. So this keeps us all limber here.
That's right.
So take care. Remember that these are your cells for your healing. Adios, David.
Yeah, thanks so much, Ed. It was great talking to you.